So today we're going to be demonstrating IM and sub-Q injections. I'm just going to orient you to the room just a little bit. If you see on the floor of the lab, we have a blue piece of tape. We need you to stand behind that blue piece of tape when you are taping because that is where the camera is. I've also set up my room for success. If you see, I have med room labeled and I have patient room so I don't get confused. I also want to make sure that I'm not preparing any medications or have any tables over here because you are unable to see what is on the videotape when I'm preparing over here. So making sure I have my tables over here so I can see where we will see our medications. So we're going to start off, we're going to be in the med room. So when I come into the med room, the first thing I'm going to do is wash my hands. In the med room, I'm going to be checking my orders and my MAR. So I see my orders. I have B. Smith, date of birth 4/24/57. I have an allergy to codeine. I see we have admit patient to med-surg unit, vital signs Q4, diet 1800 calorie ADA, activity bed rest, lab CBCD with diff, CMP, PT, PTT, and INR. My first medication I have on here is heparin, 5,000 units, subcutaneously BID. I'm going to click onto my MAR. I'm going to say B. Smith, date of birth 4/24/57, allergic to codeine. I have heparin, 5,000 units, sub-Q BID. And I have a 9 o'clock and an 1800 dose. I'm going to go back to my orders and see I have B. Smith, date of birth 4/24/57, allergic to codeine. I have influenza vaccine, IM ×1 now. I'm going back to my MAR to make sure that's on there. I have B. Smith, date of birth 4/24/57, allergic to codeine. I have influenza vaccine, IM ×1 now. I have a 9 a.m. dose. So now I've verified. I'm going to go back to my orders, make sure I have nothing. B. Smith, date of birth 4/24/57. I've reviewed the entire order and found all of my medications, so I'm done with my orders and I can go back to my MAR. I'm now back at my MAR. I have B. Smith, date of birth 4/24/57, allergic to codeine. I've reviewed all of my medications. I'm going to go ahead and click in this box up here and verify that I've reviewed my MAR. I'm going to put A, Cole, SN for student nurse, comma SPC, comma ADNP. So now that lets us know I've verified my orders to my MAR. Now I can begin my checks. So to start my first check, I'm going to take out my medications here. I see I'm giving heparin and the flu vaccine. For my first check, I will say B. Smith, date of birth 4/24/57, allergic to codeine. I'm administering heparin 5,000 units, sub-Q BID. I'm giving the 9 a.m. dose. I have heparin 5,000 units per mil, expired 01/02/20. My package is intact and not compromised. I have completed my first check for heparin. I have B. Smith, date of birth 4/24/57, allergic to codeine. I have influenza vaccine, IM ×1 now. I'm giving a 9 a.m. dose. I have influenza virus vaccine, lot number 107057, expires 10/30/20. Dosage is 0.5 mils equals 1 adult dose, and my package is intact and unopened. I've performed my first check. Now I'll go to my second check. I have my medication, B. Smith, date of birth 4/24/57, allergic to codeine. I have heparin, 5,000 units, sub-Q BID, 9 a.m. dose. I have heparin, 5,000 units per mil, expires 01/02/20. My package is intact and sealed. I have my next medication, B. Smith, date of birth 4/24/57, allergic to codeine. I have influenza vaccine, IM IM times 1 now. I'm giving the 9 a.m. dose. I have influenza vaccine. Lot number 0107-057 expires 10/30/20. The dosage is 0.5 milliliters equals 1 adult dose. My package is intact. I've now realized I forgot to put my X on my first medication, so I'm going to put it now and put it on my second one. So I've now completed 2 full checks. Now I will go ahead and prepare my medication. Before I prepare my medication, I'm going to go ahead and wash my hands. I'll first be drawing up heparin. I know heparin is going to be given sub-Q. I see on my vial it says 5,000 units equals 1 mil. I know my order said I am going to be administering 5,000 units, so I will pull up 1 mil. I'm going to go ahead and pull it up in a 3 cc syringe. So I'm going to get my syringe, and I know that I can give it with a 27 gauge needle. I'm going to pop the top. I'm going to go ahead and clean the top of that vial. And I'm going to put it in the corner so I don't knock it over. I'm going to open my syringe and attach the needle.
You checked expiration date.
Oh, I'm sorry. Before I open this package, okay, so I'm going to open this package. Before I do, I'm going to go ahead and check the expiration date. I'm going to note that it is intact. It is not open. Okay, I'm going to open it. I'm going to attach my syringe. I know I'm giving 1 mil, so I have to pressurize my vial. So I'm going to pull up 1 mil. I'm going to inject this into my clean vial, pressurize, and I'm going to pull up 1 ml. So I pulled up 1 ml. I'm going to take it out. I'm going to activate my safety device so I don't poke myself. Before I let this go out of my hand, I'm going to go ahead and label my medication. I'm going to put heparin, and I'm going to look at my vial, and 5,000 units per mil. I'm giving 5,000 units, which equals 1 mil. My patient's initials, BS, date, 27/18, and my initials. I'm going to label this syringe so I know exactly what it is, making sure that when I'm labeling, I'm not labeling where I cannot see the medication. I'm going to flag it. I can now put this down because I know exactly what it is, and I'm going to label the bottom of my vial. I'm going to put my initials, the date, the time, so that the next person knows when this was last used. So my vial is now labeled. So I've prepared this medication. At this time, I'm going to go ahead and change my needle, knowing that I cannot give an injection with the same needle that I drew up. So I'm going to go ahead and take this needle off. I'm going to go straight to the sharps. I'm going to go ahead and I'm going to lift the package of my new needle, making sure it is in date and not expired and not open. I'm going to place this onto my needle, and I'm ready to go. My next medication I'm going to pull up is an IM injection. It's influenza. I'm going to go ahead and I'm going to pop my top, clean my vial, and put it in the corner so I don't knock it over. I'm going to get out my packaging, making sure I'm checking my expiration date, making sure it's intact and it is the correct size. This is a 22 gauge. Needle attached here. It's a 3 ml syringe, and I'm going to be administering this IM, so I know I can go with a 1 inch or 1.5 inch. My packaging is all intact and my expirations are good. I'm going to attach my new syringe. I know 1 adult dose equals 0.5, so I'm going to pull 0.5 of air into my syringe. I'm going to puncture the vial, push my air, going to pull back 0.5 mils. Okay, I'm going to take it off. I'm going to activate my safety device. Okay, before I let this go out of my hand, once again, I'm going to go ahead and label with the medication, with the dose, with my patient's initials, with the date and the time, and put my initials. Labeling at the bottom, making sure that I do not cover my medication and flagging. I can put this down because I know what it is. Now I will go ahead and label the bottom of my vial so that they know when it was opened and the time. So my name, date, time. I'm going to go ahead and attach it to the bottom. Now I have both of my medications prepared. Before I go any further, I'm going to go ahead and attach my new needle to my IM injection. So I'm going to go ahead, I'm going to take off and dispose of my needle that I drew up with straight to the sharps and attach my new needle that will go into the patient. Okay, I'm going to go ahead and clean up my mess in the med room. Throw away all papers. Okay, I've completed everything in the med room. I'm going to go ahead and wash my hands because I'm done in the med room. And I'm going to pack up my medications, putting them in my drawer and not ever leaving them alone. I'm going to go out of the med room. Good morning, Mr. Smith. My name is Mandy. I'm going to be your student nurse today. How are you? Great. Mr. Smith, can I get you to tell me your name and date of birth? As I'm asking him, I'm going to go ahead and I'm going to click in my ID scan. Can you tell me your name and date of birth, Mr. Smith? I see I have B. Smith, date of birth 4/24/57. Are you allergic to anything? Codeine? Okay, well, we're not going to give you any codeine today, okay? So I'm going to go ahead and scan your wristband. Mr. Smith, would it be okay if I raised your bed up just a little bit? I'm going to sit you up just a little bit. And can I raise your bed so it's a more appropriate height so I don't have to bend down and hurt my back? Great, thank you so much. So we're going to be giving you 2 medications this morning. The first one is your influenza flu vaccine. Have you ever had the flu vaccine? Yes, every year. Okay, have you ever had a reaction to the flu vaccine? No, I don't think so. Well, if you're allergic to eggs or anything like that, you may have a reaction. Since you've had it before, you may have a little bit of tenderness and redness at the injection site, and it may be a little bit sore. Just go ahead and do some arm movements, and that will work right out. Okay? I can give your flu vaccine in I can give an IM injection in a couple of different places. Because it is the flu, we're going to go ahead and administer in your deltoid. To find that place, I'm going to take 2 fingers below the acromion process. I'm going to do my 2 fingers, and I'm going to go right into the middle. We can go in the right or the left arm. Okay, if you had another IM injection, I know that I could give it in a couple of other different places. The first one is your hip. Okay, this is also called your ventral gluteal. What I would do is take the palm of my hand, find your greater trochanter. Okay, then I would find your iliac crest with my thumb. I would split my fingers and I would go right into the middle. Okay, the next place I could give an IM injection would be on your vastus lateralis. I can take one hand above your knee and one hand below your greater trochanter, and I would go right in the middle. Because this is a flu vaccine, it's less than 1 ml. We're going to go ahead and administer in your arm. Do you have a preference? You're right? Perfect. Okay, so that's your first medication. Your second medication is heparin. Have you ever had heparin before? Oh, all the time. Great. So heparin, the preferred side is going to be in the abdomen. We're going to do 2 fingers on either side of your belly button. Have you had it in your right or your left? You had it in your left last? Okay, we're gonna give it in the right side then. Other places, if you had another sub-Q injection we could give would be in the back of the arm, the skin fat, or we could also go inside of the leg. Today we're gonna give heparin, so we're gonna go ahead and give your abdomen. So since you've had heparin before, we know heparin can cause some bleeding. So if you notice any dark, tarry stools, excessive bruising, please let us know, okay? Okay, sounds great. Okay, so I've explained everything I'm giving to my patient. I've educated them, let them know what's going on. I don't ever want to be in a patient's room and them not know what I'm doing in there. So before I administer my injections, I'm going to do my third check. I'm going to go to my computer. I'm going to grab my vial and I'm going to grab my actual prepared syringe. Okay, I have B. Smith, date of birth 4/24/57, allergic to codeine. I have heparin, 5,000 units sub-Q BID. I'm giving the 9 a.m. dose. I have heparin, 5,000 units per mil, expires 01/02/20. And I have drawn up and prepared 5,000 units of heparin, which equals 1 ml. Okay, I pulled it up and I've already attached my needle ready to go. So that is my third check. Okay, I'm gonna put these here. And actually before I put it down, since I already have this medication, I'm gonna go ahead and scan it. So I'm going to go ahead and click in the med scan box. I'm gonna take my medication and I'm going to scan it, seeing that the numbers pop up right there. My next medication we're going to do our check. B. Smith, date of birth 4/24/57, allergic to codeine. I'm going to be giving influenza vaccine, IM, ×1 now. I'm giving the 9 a.m. dose. I have influenza virus vaccine, lot number 107057, expires 10/30/20. Dosage 0.5 mils equals 1 adult dose. I have prepared in my vial influenza vaccine 0.5 milliliters. I see I have 0.5 milliliters in my syringe, and I have my label completely filled out. So I'm going to click in my med scan box. I have to scan the label or the medication before I administer it. And it's not going to scan. So we're going to say, there we go. Perfect. We have that scanned, and I'm going to go ahead in here and I'm going to put my third check. Okay? I've completed all my checks, educated my patient. Now I'm ready to give. I'm done with these vials. I'm going to go ahead and put them in here. I have my injector pad. And I have some alcohol swabs. I'm making sure I'm very prepared before I go in that room, making sure I have lots of alcohol swabs and perhaps a Band-Aid if you have a bleeder. So the first injection we're going to be giving is going to be the heparin. I've measured 2 fingers outside of the abdomen. Oops. So before I go ahead and administer my medication, I'm going to wash my hands. After I wash my hands, I'm going to go ahead and put on my gloves. If you put alcohol on your hands, you have to let it completely dry before it's effective and before you can get your gloves on. And my gloves are dripping, so I'm going to go ahead and get another pair. I always want to be safe before I administer any medications, not only for the patient, but for myself as well. And they're ripping good. There we go. Okay, so now I have my gloves on. I'm going to go ahead and I'm going to administer my sub-Q injection first, which is going to be the heparin. I'm going to go ahead and loosen the cap of my needle so that I don't have to worry about crossing over. Either way is fine. And you can take it off here, or you can reach on the other side and do it. Okay, I'm going to go ahead and open my alcohol swab. I'm going to grab a good piece of tissue, clean from the inside out, and allowing the alcohol to completely dry. I'm going to take my needle. I'm going in at a 90 degree. I'm pinching 1, 2, 3, and poke. And I'm sticking in, pushing the medication in, making sure I'm pinching the whole entire time. And then I'm going to let go and immediately go to the sharps. Okay? How was that? Was it okay? A little bit of a pinch. I'm very sorry about that. Okay, we have one more injection for you, Mrs. Smith. Okay, this is a sub-Q, or I'm sorry, an intramuscular injection. It is our influenza vaccine. We're going to go in the deltoid, so I'm going to go ahead and measure my spot and making sure I identify my landmarks. Okay, I'm going to go ahead and Z-track over, start in the middle of my alcohol swab, and go out. I'm going to take my medication, drop my lid. I'm going at a 90 degree angle. Because this is an influenza vaccine, we are not going to aspirate. All other injections that are given IM, we are currently aspirating, so we will not aspirate with influenza vaccine. So I'm going to go ahead in a darting motion stick. 1, 2, 3, and stick. I'm going to stabilize, and I'm going to push in slowly and count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and out and straight to the sharps. You can go ahead and clean that site. Was that okay, Mrs. Smith? Yes. Well, hopefully you won't get the flu this year, okay? After I've completed, before I do a whole lot of things, I'm going to take my gloves off, and I'm going to wash my hands. So now I've given all of my medications. I'm going to clean up my area here. I'm going to go back to my charting, and I'm going to make sure that I document where I exactly gave that medication. So for our heparin, I know we gave it sub-Q. We gave it in the left upper quadrant, okay? If you did right lower quadrant, you would do RLQ, and you can abbreviate that way. After I put my site, After you put your site, you go ahead and initial your name. Same for the influenza vaccine. We are going to put the site. We gave it in the right deltoid. And we are going to initial. At this time, I'm going to go ahead and I'm going to make sure that all of my information is cleaned out. I'm verifying or citing my medication. So I'm going to put A. Cole, my title, student nurse, SPC, ADNP, and my initials are AC. I have my initials here so they can see who actually gave that injection. I'm going to scroll up and make sure everything's filled out. My verification is done for my MAR, my ID scan, my medication scans, my 3 X's, where I gave it, left upper quadrant, AC, right deltoid, AC. And I'm seeing I have my name, title, and initials. Okay? I'm going to go ahead before I leave you, Miss Smith. I'm going to go ahead and lower the head of your bed. Is that okay? Oh, you want to sit up? Okay. Well, for your safety, I'm going to go ahead and lower the bed all the way to the ground. Is there anything else I can get for you right now? Oh, you're going to take a nap. Wonderful. Would you like me to turn Jeopardy on? It comes on at 11. You don't like Jeopardy? Okay, we'll turn it to People's Court. Okay, your bed is all the way down. I have your call light within reach. And my name is Mandy, and I will be here if you need anything. All right, thank you. I'm going to go ahead and leave the patient's room, washing my hands. and taking all of my supplies with me.